Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute video podcast. This is the second video podcast that we do with the Dr. Zahra Figueredo. And she's the research and technical director of the Institute. How are you, doctor?
Hello, very good, Luis. Thank you so much. Yep.
So we do have an interesting topic because it's all about the stem cells and what are the benefits of the stem cell therapy, doctor?
Right. That's exactly our topic today. We're very eager and excited to address this topic because we will go into what stem cells are, how they actually work. We hear stem cells, the word or the phrase being thrown around, stem cell therapy, stem cell treatment, but a lot of people don't understand the breadth of it. And so we're here to clarify that.
So does stem cell regenerate tissues, doctor?
Yes. So what stem cells do let's start with what stem cells are. Stem cells are cells that are a little more primitive in that they can become other tissues. So we have autologous stem cells. We have allogenic. Autologous are stem cells that are your own. Auto meaning self in Latin. And then we have allogenic stem cells, which come from a different source. We work with both. And so basically what the capacity of a stem cell is to regenerate itself and regenerating a tissue. So, and in this case, usually it's a damaged tissue. And so that's what stem cells do and basically what they are. And so the different sources that we use at the Stem Cell Healing Institute are bone marrow derived. We have a proprietary method of growing and producing brand new, non-toxic, highly potent, extremely high numbers of stem cells in vivo while they're still in the body without having to culture them or grow or expand them in a lab. And so we're very proud of that. So we use bone marrow, we use umbilical cord if we have to. We choose not to. It's a little, if we don't have to, as well as just because it's a little bit more costly for the patient when we don't really need it. When we have our proprietary bone marrow stem cells. We also use adipose-derived, not so often anymore because we get the numbers and the great effect from the bone marrow. And then we have also a proprietary endometrial stem cell, which, as far as I know, we're the only clinic that offers endometrial, and that comes from the uterus of a young, healthy patient. And so these are the types of stem cells that we use and what they do.
And what are the type of stem cells that we don't use?
We do not use embryonic stem cells. Thank you for asking that, because that's really important that patients understand, or prospective patients understand, that embryonic has not been proven safe. They can be effective, but definitely not proven safe. And so we just don't go there.
Yeah. And since you're talking about stem cell safety, a lot of people are a little afraid. Can we explain why people are afraid of stem cells?
Yes. Thank you, Louise. I often get asked that, and it's a very important question. Basically, embryonic stem cells, which are the stem cells that we don't use, those are very, very lower down in the primitive cell line. So they are completely undifferentiated. They're taken from an embryo. So there's the controversy in that, in and of itself. And how those stem cells were produced or received. And then the biggest controversy in terms of safety is whether these stem cells die. Okay, and this is key here, because the stem cells that we use are adult mesenchymal stem cells. they die after doing their job. The problem with embryonic stem cells is they can continue to regenerate, continue to grow tissues into an uncontrolled growth.
They may provoke tumors, I suppose.
Into tumors, exactly. And so that's the worry with embryonic stem cells.
So just to make it clear, we don't use those stem cells. Doctor, why is the clinic in Guatemala since you are a Canadian? I mean, what do you do? Why are you here in Guatemala, and what you do in Guatemala?
Yes, that is, that's a question I'm asked very often, being so far from home. Well, I was practicing in Arizona. I went to school in the States, in Canada, and Europe. And I was practicing in Arizona for many years, doing stem cell and other alternative and regenerative medicine. And we just found that the scope of practice in the US and Canada is so restrictive that results are inhibited. We just don't see the results that we see here. And the reason for that is FDA now and Health Canada, they've just completely outlawed stem cell treatment. There was a version of stem cell treatment in Canada available. Again, very restricted, but even that's outlawed, which is extremely unfortunate. North America is going backwards instead of forwards. And so what brings me here is because of the restrictions in North America that we don't have here, where it allows us to very safely and very effectively provide a stem cell treatment that really makes the difference in the quality of life of a patient. And some of those, I would like to get into a little bit of what those restrictions are, especially now in the US, because there is a version of stem cell treatment available in the US, but what is the difference? So in the US, only autologous stem cells are allowed to be used. So only the ones from the patient's own body. So if we wanted to use endometrial from another source, from another female patient, or umbilical cord cells, it's illegal to do that because it's coming from outside of the patient's body. Number one. Number two, the stem cells have to be minimally manipulated, which means they cannot be grown in a lab to get higher numbers, which makes just that in and of itself can make the treatment so much more effective, is having the right numbers of viable stem cells. So they cannot be grown. They cannot be combined with any other growth factor from the patient's blood or exosomes. These are all proteins and growth factors that can provide a world of a difference in a stem cell treatment. So that's considered an unapproved drug in the US. So these types of prohibitive factors that are not allowed in the US can very much influence how a patient, the results a patient gets. So, and these are all things that we do in Guatemala.
Okay, since this podcast is the benefits of the stem cell therapy, what conditions do you treat that can be benefited from stem cells?
Yes, we have such a wide range of conditions that can benefit from stem cells. We have physical injuries, sports injuries, knees, joints. We have a lot of hip and knee patients with or without replacement and prosthetics. So it's very, very phenomenal. We have recovery of, for instance, hip and knee replacements that is a fraction of the time of a regular replacement without the stem cells. So that's just one example. But we treat autoimmune conditions such as multiple sclerosis, rheumatoid arthritis, diabetes type 1. These types of conditions are Parkinson's also is an autoimmune condition. Autoimmune conditions are conditions that are where the body is attacking itself. We have antibodies that don't recognize foreign versus self, and they attack the body itself. And specifically for autoimmune conditions, we like to use a combination of endometrial stem cells, which again come from a healthy female uterus, combined with the bone marrow stem cells, because we just find that endometrial has a great effect on autoimmune conditions and is just extra anti-inflammatory. And so the combination we have found to be phenomenal. Other conditions that we treat, other neurodegenerative conditions, spinal cord injury, stroke, eye conditions such as macular degeneration, retinitis pigmentosa.
Eye injuries.
Eye injuries, optic nerve injuries. So any injury. And, a lot of patients ask me, how do the stem cells know what to do or where to go? And because sometimes very often we apply the stem cells into the blood through an IV infusion and locally. So we do everything we possibly can, intranasal aspiration as well, intrathecally when we have neurodegenerative conditions. We use intrathecal and intranasal aspiration, like a nose spray of stem cells with autistic patients a lot. And how do they know where to go? So there is this phenomenon in the body where a damaged tissue or a damaged cell provides or releases inflammatory factors that are specific for that tissue and that cell. And these are called cytokines. So when we place the stem cells into the blood or near a damaged tissue or right at the site of injury, the stem cells have these signals from that damaged cell with these cytokines, these inflammatory factors, that, hey guys, this is where the damage is. Come over here. Let's build. And so that's how smart the body is in knowing, and the stem cells in knowing where the damage is, where they need to go.
And I will mention that this also works for respiratory issues and.
Yes, yes. Thank you for asking that, because yes, lung conditions, emphysema, pulmonary fibrosis, pulmonary COPD, a lot of asthma. A lot of the lung conditions respond really well to the stem cells.
Yeah, I've been learning about stem cells for a long time, so I know a little about the topic. So, doctor, also, can these stem cells use for cosmetic purposes?
Yes, that's another condition that we address very often. We have a total body rejuvenation process where it's stem cells IV with mannitol. We almost always use mannitol in order to get the stem cells to the brain, bypassing the blood-brain barrier. And then we do local injections for cosmetic and aesthetic purposes. So that could be the skin. Very obviously, it can, for the skin and different areas where a patient might have scarring because of surgery. And so, yes, we address cosmetic and aesthetic purposes also.
Doctor, last but not least, I need to ask you, what is different about the Stem Cell Healing Institute from other clinics?
Yes, thank you for asking that. Because when patients are vetting our clinic, which is, of course, very important for the prospective patient to do, because it's really important that they're educated. And our job is not to convince them that we're better than anyone. It's about being educated. And so it's really important that prospective patients and patients understand that we have a very comprehensive approach. We will address lifestyle. We will address key dietary factors. Stress is so huge in healing, and that's so much part of our well-being, as I always say. We will address genetics. We will address, we have a pre and post-treatment protocol. So it lasts up 3 months. So the patient is only with us for about a week, 7 to 10 days, but the rest of the treatment they go home with, which is really important. And so it involves a total detox program, as well as hormone treatment and hormone therapy, age appropriate, and it can be specific to female and male, as well as oxygen therapy and stem cell enhancement formula, which is specific for the patient. And it's a key combination of herbs and minerals, again, specific for that patient. So our treatment entails all of that, and we have ongoing support, and that's really important for us.
In this case, if the patient wants to contact you, where should they write?
They can reach us at info@stemcellhealinginstitute.com. They can go to our website through www.stemcellhealinginstitute.com and fill out a contact us form. We have also, for sake of ease, we have www.stemxcure.com as well, and they can call us up and reach us through social media as well.
Sure. By the end of this podcast, you will find all the information how to reach Dr. Figueredo. So we are going. It's important to let you know that we are going to have a TikTok channel as well, right, Doctor?
That's right. We're excited to launch our new TikTok channel as well.
So I really appreciate your time, Doctor.
Thank you, Luis. It's always a pleasure.
You have a wonderful evening.
Thank you. You too.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.